Have you ever had a truly gut-wrenching experience? Or maybe you're about to do something stressful, like a job interview or a big presentation,
Oh, yeah,
and suddenly you feel those famous butterflies, like there's a whole commotion happening right in your stomach.
definitely. We use those kinds of phrases all the time, don't we? Mixing up emotions and physical feelings.
Exactly. It's like this messy, powerful
Yeah.
package, and it feels so real.
And that feeling, that sense that your deepest emotions are somehow landing in your gut. It's much more than just a metaphor. The gut is actually deeply wired into our emotional centers. There's this constant conversation going on.
So today, we are diving deep into the science behind these really common feelings. It's what researchers call the gut-brain axis.
Mm-hmm.
And you've given us some great material from Harvard Health on this, which basically confirms this connection is, well, it's no joke. It's robust, complex,
Yeah.
really central to understanding a lot of modern health issues.
That's right. And our mission today for you listening is really to take a deep dive into these findings. We want to unpack this intimate two-way relationship.
Two-way.
Yeah, with paying special attention to how things like anxiety and chronic stress can translate directly into physical digestive problems.
And importantly, what can actually help, right? What approaches seem to work when maybe the usual treatments don't quite cut it.
Exactly. What's proven effective?
Okay, so to really get the power here,
Mm-hmm.
I think we need to start with just how immediately the brain impacts the gut.
Mm-hmm.
The sources point out that the brain has such a direct effect, it's almost startling. Like the very thought of eating,
Right.
not even smelling food, just thinking about it, anticipating it. That alone can trigger the stomach to release its main digestive juices before any food is even there.
It's amazing, isn't it? That's the brain getting the body ready for action, a real preparatory control.
But you said two-way street, so that control isn't just flowing downwards.
No, definitely not. That example shows the brain telling the gut what to do, sure. But the GI tract, the gut itself, is constantly sending really powerful signals back up to the brain.
Ah, okay. So it's not just the brain acting like the big boss ordering the digestive system around. The gut has a voice too.
It absolutely does. Think of it less like a top-down command structure and more like a busy highway, maybe? A massive communication line running back and forth between your head and your stomach.
A highway, I like that.
Yeah. So when the brain is troubled, maybe it's acute anxiety, maybe chronic sadness, deep-seated fear, whatever, it sends signals down that highway, and those signals can rapidly turn into physical symptoms in the gut.
Like pain or changes in bowel habits.
Exactly. Pain, cramps, diarrhea, constipation, those kinds of things. But, and this is the other direction, when the intestine itself is troubled, maybe it's inflamed or having painful spasms,
Okay.
those signals travel straight back up that highway to the brain, and they can directly influence your mood, your emotional state.
Wow. That sounds like a potential vicious cycle. A feedback loop, almost.
It can be.
So if you're dealing with ongoing gut problems, that distress itself could be the cause of your anxiety, or it could be the result of your stress.
That's precisely the challenge this research highlights. It can be incredibly hard to tell where the problem actually started. Did the stress cause the gut issue, or did the gut issue fuel the stress?
Because they're so tightly linked.
Exactly. The brain and the GI system are they're far too intimately connected to really study one without considering the other.
Right.
And this connection, this intimacy, becomes absolutely critical when we start talking about functional GI disorders.
Okay. These are the really frustrating ones, aren't they? Where someone has chronic stomach pain or cramping or bloating, maybe diarrhea,
Yeah.
but they go through all the tests, endoscopies, scans, blood work, and the doctors essentially say, well, everything looks physically normal.
Precisely. The test results come back clear, maybe showing no inflammation, no ulcers, no obvious structural problem, but the person's suffering is completely real.
And that's where this gut-brain link becomes crucial.
It's paramount. For those functional disorders, the Harvard Health material makes it really clear. You basically cannot successfully treat or heal that distressed gut without factoring in the huge role of stress and emotion.
So ignoring the stress side,
Yeah.
it's like trying to solve an equation with two variables, but you're only looking at one of them.
You've got it. You're missing a massive piece of the puzzle.
Okay, let's dig into that a bit more, because this really hits at how we often think about illness, doesn't it?
It does.
If the medical tests show no physical cause, I think a lot of people, maybe even some doctors sometimes, jump to the conclusion that, well, it must be all in your head.
Right. That's the immediate assumption for many.
But the research you shared is adamant that this is just wrong. It's a dangerous and inaccurate way to think about it.
Absolutely. The article really emphasizes this point. These functional GI conditions, the heartburn, the cramps, the loose stools, whatever the symptom is, they are not imagined. They're not fabricated. They are real physiological symptoms people are experiencing.
Okay, but help me understand this then. If someone takes, say, an antacid for heartburn or a medication to slow down their bowel movements and they get immediate relief, doesn't that suggest the problem is physical? How does the mind-body view explain that?
That's a really great question, and it gets into the subtlety of the physiology. It's not really an either-or situation, you see. Psychology doesn't just cause a vague feeling of being unwell. It physically changes how the gut functions.
Ah, okay.
The article explains that these psychosocial factors, so stress, depression, anxiety, difficult life events, they directly influence the actual physiology of the gut.
So stress isn't just making me feel nauseous or tense. The stress hormones and nerve signals are literally changing how my digestive system is working, the mechanics of it.
That's exactly right. Stress hormones, neurotransmitters, the signals firing down nerves, they directly impact the gut's movement, its motility, and its contractions.
Right.
Imagine your GI tract as like a long muscular tube, and its walls are constantly squeezing in a coordinated way to push things along, rhythmically.
Okay, peristalsis.
Yeah. Now, when you're highly stressed, it's like the control system for those muscles goes haywire. Sometimes the muscles might clamp down or spasm like a traffic jam, causing cramping and maybe constipation.
Gridlock.
Gridlock, exactly. Or other times, the stress signals might make everything speed up dramatically, like clearing the roads for an emergency, leading to urgency and loose stools or diarrhea. Stress is literally messing with the traffic flow in your gut.
That makes so much sense. It makes the physical symptoms feel much more, well, physical. It's a direct bodily response to a psychological state.
Precisely. And then you have to layer on top of that the whole issue of perception, how the pain is actually felt. And this is where it gets really interesting.
Right.
The research indicates that many people who suffer from these functional GI disorders actually perceive pain signals from their gut much more acutely than other people do.
So it's like their internal discomfort volume knob is just turned up higher.
That's a great way to put it. Their brains are fundamentally more responsive, more sensitive to the normal signals coming up from the GI tract. The technical term is heightened visceral sensitivity.
Visceral sensitivity.
Yeah. Think of it like your brain has this internal monitoring system constantly checking on the gut, right? For someone with these issues, that monitoring system is set to be hypersensitive. Normal gut events, a bit of gas moving, normal contractions, things that most people wouldn't even notice, their brain registers them as significant, potentially painful events.
Wow. Okay, so if that sensitivity dial is already turned way up, what happens when you add a big dose of external stress into the mix?
Well, stress then acts like a powerful amplifier. It does two things simultaneously. First, as we just discussed, it can directly cause those physiological traffic jams or speeding in the gut.
Right, the physical disruption.
And second, it makes that already heightened sensitivity even more sensitive. So not only is the gut potentially functioning abnormally due to stress, but the brain is also interpreting every signal from the gut as being more intense, more painful than it otherwise would.
So stress makes the physical problem worse and makes you feel that problem more intensely.
Exactly. That combination, the heightened sensitivity plus the stress-induced physiological disruption, that's why these symptoms can become so persistent and, frankly, so debilitating for people.
Okay, this deep connection, this physiological linkage, it really lays the groundwork for the next logical step, doesn't it? Which is treatment.
Yes.
If the brain and our emotional state can physically cause or worsen these gut symptoms, it just makes perfect sense that addressing the brain, addressing the psychological side, should lead to physical improvements in the gut.
That is absolutely the key takeaway from this line of research. And it really challenges maybe the more traditional approach of just treating the gut symptoms in isolation, with medication alone. Because multiple studies have now found really significant results when psychological care is integrated. What they're seeing is that psychologically based approaches, things specifically designed to treat anxiety or depression or to help people manage stress better, these approaches lead to significantly greater improvement in the actual digestive symptoms.
Wait, say that again. Greater improvement in the digestive symptoms.
Yes. Greater improvement in the physical gut symptoms compared to using only conventional medical treatment for the gut.
I think we need to pause on that for a second because that's huge. We're not just saying therapy helps you cope with the stress of having gut problems. We're saying the therapy itself leads to better improvement in the physical symptoms, the cramps, the pain, the bowel issues, than just treating those physical symptoms directly.
That's what the evidence is showing.
Yeah.
It strongly suggests that simply trying to manage the symptom downstream, like blocking stomach acid or slowing bowel motility, often misses the underlying driver, especially in functional disorders. When you work upstream, when you address the anxiety, the stress, the emotional factors, when you essentially help the brain recalibrate, maybe dial down that hypersensitivity we talked about.
Right, turning down the volume knob.
Exactly. You are simultaneously improving the physiological function of the gut itself. You're helping to fix those malfunctioning traffic signals, to use our earlier analogy.
So for you listening, what does this actually look like? We're obviously not saying you should self-diagnose or anything.
No, definitely not.
But what kind of psychological approaches are we talking about here? What does the research mention that actually shifts gut health physically?
Well, the sources point to a few key areas. Cognitive behavioral therapy, or CBT, is a big one that helps people identify and change the negative thought patterns and behaviors that often fuel stress and anxiety.
CBT. Makes sense.
Relaxation techniques are also commonly used, things like deep breathing, mindfulness, meditation tools to help calm the nervous system's stress response in the moment. And interestingly, something called gut-directed hypnotherapy has shown really promising results in some studies.
Hypnotherapy specifically for the gut.
Yes. It uses hypnotic suggestion to influence gut function directly, things like reducing pain perception, normalizing motility. These aren't just about feeling better mentally. They are techniques designed to actively leverage that brain-gut connection to change the physical reality in the gut. They're essentially trying to rewire that communication highway we talked about.
That sounds incredibly hopeful, especially for anyone listening who's been stuck in that cycle of chronic gut issues where all the tests come back negative.
It offers another avenue, definitely.
And it really brings up a crucial question for you, the listener, doesn't it? If you are dealing with that recurring heartburn or those chronic abdominal cramps or persistent loose stools, and maybe the usual medications haven't fully solved it, could a vital part of your strategy need to involve managing those upstream emotional factors?
The research strongly suggests that for many people, an integrated plan, one that addresses both mind and body, is likely to be the most effective.
Okay, so that leads us naturally to thinking about actionable steps. If you suspect that maybe your mind and your gut are kind of locked in this stressful battle, what should you be looking out for?
Well, beyond the obvious signs of stress itself, feeling overwhelmed, anxious, low mood, pay close attention to those specific digestive symptoms that the research strongly links to stress overload.
Right, the ones that often flare up when life gets hectic.
Exactly. The Harvard Health material highlights that common trio we've mentioned. Frequent heartburn that doesn't seem related just to food, persistent or recurring abdominal cramps, and chronic or intermittent loose stools or diarrhea.
Those three seem to be major red flags for a potential stress link.
They are definitely key symptoms to be aware of in this context. But the absolute crucial next step, the main recommendation from the research, is clear and responsible.
Don't try to figure this out alone.
Absolutely not. If you are experiencing these kinds of digestive symptoms, especially if they're accompanied by significant stress or anxiety, the most important thing is to discuss them openly and thoroughly with your doctor.
Yeah, lay it all out. The physical symptoms, the stress levels, the timing.
Precisely. Your doctor needs the full picture to rule out other potential causes and to help you figure out the best approach.
And working together, you can potentially develop like the dual strategy, right?
That's the ideal often, finding strategies that help you tackle both fronts simultaneously. So looking for effective ways to manage or reduce the stressors in your life and finding ways to ease the resulting physical gut discomfort at the same time. It's about taking a holistic view of your health, really acknowledging that mind and body are interconnected.
This has been a really insightful deep dive, I think.
Yeah.
It shines a light on a system, this gut-brain axis, that maybe gets ignored too often.
I agree. We've really established, based on the source material, that this gut-brain connection isn't just a catchy phrase. It's a powerful bi-directional loop.
Right. Our emotions literally, physically change how our gut moves and how sensitive it is.
And just as importantly, the state of our gut, whether it's calm or inflamed or spasming, sends signals back up that directly influence our emotional state, our mood, our sense of well-being.
And that robust finding, that solid science, brings us to our final kind of provocative thought for you to explore. Well, For centuries, maybe particularly in Western medicine, there's been this effort to draw a really sharp line between mental health and physical health, like they're in totally separate boxes.
True, a very distinct separation often.
But, as this research clearly shows, treating anxiety and stress can physically, demonstrably improve chronic digestive symptoms, and sometimes do it more effectively than just focusing on the physical symptom alone. What does that really demand of us?
It demands a shift in perspective, doesn't it?
I think so. It suggests we really need to fundamentally challenge that artificial boundary we've created between mind and body. Maybe we need to stop so quickly dismissing complex physical pain or discomfort as, oh, it's just stress.
Because the stress is causing a physical effect.
Exactly. This science seems to demand that we consider the whole person, the emotional context, the environmental stresses, the mental state in every diagnosis, regardless of whether the presenting symptoms seem purely physical. The line is far, far blurrier than we've traditionally assumed.
A fascinating implication. It really opens up how we should think about health and healing across the board, not just for digestive issues.
Absolutely. Something for all of us to think about.